Hospital case management is not just discharge paperwork. It is one of the busiest, most team-based case management roles in healthcare. And if you are a nurse thinking about moving beyond the bedside, but still want to stay close to the clinical side of patient care, hospital case management may be one of the most natural paths to understand first. Because hospital case managers are often working right in the middle of the patient's care team. They are looking at the plan, the barriers, the next level of care, and what needs to happen before the patient can safely leave the hospital. At the bedside, you are focused on the patient's care during your shift. You are assessing, medicating, documenting, educating, and responding to changes in condition. A hospital case manager is looking at a different layer of the same patient story. They are asking, what is the discharge plan? What does this patient need after the hospital? Are they safe to go home? Do they need home health, rehab, skilled nursing, equipment, transportation, medication support, or family involvement? And just as important, what is standing in the way? That is the heart of hospital case management. It is not simply getting someone out of the hospital. It is helping make sure the next step makes sense for the patient's condition, support system, and available resources. A typical day can move quickly. A hospital case manager may start by reviewing new admissions, checking patient status, looking at expected discharge dates, attending interdisciplinary rounds, talking with providers, reviewing therapy recommendations, and identifying which patients may need extra discharge support. Then the day starts changing. A provider may say a patient is ready to discharge, but the patient still needs oxygen arranged. Therapy may recommend skilled nursing placement. A family may disagree with the plan. Insurance authorization may still be pending. A patient may not have transportation, or a facility may decline the referral. So the case manager is constantly prioritizing. Which discharge needs attention first? Which barrier could delay the patient another day? Which conversation needs to happen now? Which patient is at risk for an unsafe transition if the plan is not clarified? That is why hospital case management is not usually slow. It is less physically demanding than bedside nursing, but it can still be mentally demanding. You are not running from room to room giving medications, but you may be moving between conversations, phone calls, documentation, referrals, team updates, family questions, and discharge barriers all day. The pressure is different. At the bedside, the pressure is often immediate patient care. In hospital case management, the pressure often comes from timing, coordination, communication, and the reality that not every patient has an easy or obvious discharge plan. For example, imagine a patient who is medically stable after a fall. They are no longer needing acute hospital care, but they cannot safely go home alone. Therapy recommends skilled nursing. The family agrees, but the patient has a specific facility in mind. That facility has no beds. Another facility has beds, but insurance authorization is still needed. That is a hospital case management problem. The case manager is not just checking a box. They are helping coordinate the next safest step while balancing patient preference, clinical recommendations, payer requirements, facility availability, and the hospital timeline. This is where bedside nurses often have a strong advantage. If you have worked at the bedside, you understand what can happen when discharge planning is rushed or unclear. You have seen patients get confused about medications. You have seen families overwhelmed by wound care, mobility needs, oxygen, or new diagnoses. You have seen patients come back because the plan did not fit their real life. That experience helps you think ahead. Hospital case management uses that same clinical awareness, but applies it to transitions of care. You are not only asking what the patient needs today, you are asking what needs to happen next so the patient does not fall through the cracks after discharge. Now, one important thing to understand is that hospital case management can look different depending on the hospital. In some hospitals, the RN case manager focuses more on medical necessity, utilization review, payer communication, and discharge planning. In others, The case manager may be heavily involved in coordinating services, speaking with families, arranging home health, or working closely with social work. Social workers are often key partners in hospital case management. They may help with psychosocial needs, complex family situations, community resources, guardianship concerns, housing instability, substance use resources, or long-term placement issues. The exact division of responsibilities depends on the organization. That is why nurses should not assume every hospital case manager role is the same. During an interview, it is worth asking how RN case managers and social workers divide responsibilities, how many patients are typically assigned, what units the role covers, and how much of the job involves utilization review versus discharge planning. Those answers matter. A case manager covering a busy emergency department may have a very different day than one covering an orthopedic unit, ICU step-down, oncology, maternity, or a general medical surgical floor. The patient population affects the pace. The unit culture affects the communication. The available resources affect the discharge plan. Hospital case management can be a good fit for nurses who like teamwork, problem solving, and staying connected to the clinical environment. It may also fit nurses who enjoy coordinating with providers, therapy, social work, families, facilities, home health agencies, and insurance companies. But it may not be the best fit for someone who wants a very quiet or predictable role. There are interruptions. There are urgent discharges. There are difficult conversations. There are patients who do not qualify for the service everyone wants. There are families who are frustrated. There are times when the safest plan is hard to build because the resources are limited. That does not mean it is a bad role. It means nurses should understand the reality before applying. If you are interested in hospital case management, start learning the language of the role. You will see terms like discharge planning, transitions of care, length of stay, avoidable delay, level of care, medical necessity, observation status, inpatient status, skilled nursing facility, acute rehab, home health, durable medical equipment, and prior authorization. You do not have to master every term before you apply, but becoming familiar with the language will help you understand job descriptions and feel more confident in interviews. It also helps to translate your bedside experience clearly. Instead of saying, "I took care of patients on a med-surg unit," you might say, "I cared for patients with complex discharge needs, coordinated with interdisciplinary team members, provided patient and family education, identified safety concerns, and supported transitions from hospital to home or another level of care." That connects your experience to hospital case management. Because the role is not about leaving your nursing knowledge behind. It is about using that knowledge to support safe movement through the healthcare system. The biggest takeaway is this: hospital case management is a fast-moving coordination role. It sits close to the bedside, but it is not the bedside. You are still using nursing judgment, but instead of focusing only on direct care tasks, you are helping build the next step in the patient's plan. For nurses who want to move beyond bedside nursing but still want to work closely with the care team, hospital case management can be a strong option. Just make sure you understand the pace, the responsibilities, and how the role is structured at that specific hospital. Because the title may be the same, but the day-to-day work can look very different. And if case management is the path you are curious about, we have a place for you to start. To better understand case management beyond the bedside, click the link below and visit the CMI landing page. You can start learning what case management is, how the role works, and how your nursing experience can translate into this next chapter of your career. Because your nursing career does not have to end at the bedside. It can grow from there. And if you are comparing different case management paths, watch one of the videos on screen now. One video is a deeper dive into insurance case management. The other is a deeper dive into community-based case management. Start with the path that feels closest to the kind of nursing role you are curious about.